Hello, everyone. Welcome to another interview on our continued series with alumni of our first class. Today, I'm very pleased to introduce to you Dr. Harris Ahmed from the class of 2020. Harris, welcome.
Thank you, Mr. Homer. It's good to see you again.
Great to see you. And we'll start off by asking, tell us a little bit about where you're at, your residency, and what has been some of the highlights of your experience to date.
Yeah, so I'm doing ophthalmology in Loma Linda University in Loma Linda, California, back where I was raised here in the Inland Empire region of California. I do doing ophthalmology, but the first year of our residency is more of a general medicine year. So I'm doing ICU, I'm doing internal medicine months, and the highlight has been, having the privilege to work on the front lines during this pandemic and admitting and treating COVID patients, and it's been very humbling. But it's been a highlight, definitely, just being able to experience that, and I'm very grateful.
That's great to hear. And today is the 13th of January, and the vaccine had just started kind of rolling out as we started the new year. How's the rollout going where you're at right now?
Yeah, the rollout's going pretty good. I got my first shot in the middle of December, and I just got my second shot 21 days after, just on the 9th, actually, or the 8th, rather. So we've been having, a good time here in terms of vaccine rollout. We had access to it pretty early. It was scheduled. It was very well organized. We were
Mhm.
able to kind of sign up online, and we got emails to follow up. And they even sent us emails afterwards to make sure we got our second dose on time. So thankfully, we've been fortunate here at Loma Linda to have access pretty good to the shot.
Super. So as you reflect back to when you first came to the college, started medical school here, what are some of the top things that you could share with students that are watching or those that are looking to apply to go to medical school? What advice would you give them to prepare, and what helped you prepare for your interview and your ultimate match and placement into a residency?
I think that's a great question. And I like to start with intangibles. So the first thing I would say is do not limit yourself. Don't self select yourself out of any program or any specialty or hospital because you think it's beyond your capabilities or anything like that. So having that approach is really important. Is not self-selecting yourself out, not limiting yourself. Number two, being very aggressive with networking and advocating for yourself locally. If you're in Las Cruces, our school's affiliated with ACGME teaching hospitals. We have multiple residency programs. Go to the grand rounds when you get a chance. Introduce yourself to people. Try to get on some research early on. We're affiliated with New Mexico State University. That was a huge opportunity and platform for me and my classmates. We had a classmate who helped develop a patent through New Mexico State. I myself was able to work with the former Surgeon General, Dr. Novello, on a public policy project. A lot of my classmates were doing a lot of great research through New Mexico State. So I would say take advantage of the local resources that you have. You're also getting a really unique experience. You're training in the borderlands. You're getting third world country exposures from Mexico. You're getting Native American populations. Then you're getting the local New Mexicans. So you're getting a lot of diverse pathology, different cultures. It's an amazing place to train. So take advantage of that. And it's a unique story. Also take advantage of the fact that you're in New Mexico. There's only two states, or two medical schools rather, in the state of New Mexico. And that makes you unique and memorable to residency programs. They remember that. They want things that are unique, and you should definitely be taking advantage of all these unique elements.
That's great advice. And, it reminds me right now, we're in the process of opening up another hub, clinical hub for our core rotations in Gallup. And those individuals that are looking at that, our current dean, Dr. Peratt, has encouraged them to look at it from a totally different perspective. And that perspective is how many medical students in the United States could say that they're in an area that is near the Navajo Nation and
Yeah.
experiencing the type of pathology that you're going to experience there, And how many students can say that when you go to a residency interview? Would you agree with that advice?
I mean, you can't put any, value on that type of experience and exposure. One of the things that I liked about BCom, you look at the Las Cruces Hub, for example, you get structured rotations in a setting where there's residents, there's attendings, and you're the medical student, and then you get kind of community-based rotations where it's just you and the local doctor. And because of that, you have a diversity in experience, which is very marketable to residency programs. You can say to them that I'm able to work and I have experience in these very structured academic settings. And I also have experience in these kind of community-based settings. So you're very versatile. And that's yet another kind of point that you need to really, key in on your personal statement in your interview. You need to really market these things that you have access to, because they're all unique.
Exactly, and I should have mentioned that since you've left, and the inaugural first PGY1 residency group started in Gallup at Rehoboth Medical Center, and our regional dean, Dr. Wengler, is heading up that family practice residency. So just an added value too, like you were saying, community medicine, the Navajo Nation, the pathology that they're going to see, but also side by side with residents. You kind of have the best of everything right there. So on that. So appreciate you reinforcing that message as folks look at that rotation location. All right, when you think back to Las Cruces, the community, you came from southern New Mexico. If I remember right, you were a USC fan. If I remember the first orientation, I think you were wearing some USC garb, if I remember right. Is that true?
That's exactly right. I was wearing USC socks, and we were speaking in the bathroom. We were both washing our hands.
That's right. And I had to give you a hard time since my alma mater, we've only played you twice and we beat you twice. And that's, anyway. But it's a great team. Coming to southern New Mexico, what do you miss? What did you value about the community at large?
There's such a loving community. When I got there, if I would have my BCom shirt on or a BCom sweater, even if I didn't, people would just tend to ask you how you're doing, are you from this area, in a very welcoming way, because they wanted to know if they could offer you any help or any guidance, local hiking spots, local restaurants. They want to give you recommendations. And then they would be very grateful that we came from all these different states and regions across the country to serve in their state. And one of the things that's nice about BCom is they've partnered with a lot of GME. Sometimes schools will be made and there's not much residency affiliation, but with BCom there's a significant amount already, and it's going to continue to develop. And because of that, they also have this comfort of knowing that a lot of these physicians, they're going to stay long term in this region as well. So I miss their friendliness, their warmth. It definitely miss those things about the people.
That's great. And within BCom, there's plenty, I'm sure, but top of mind, if maybe you want to do a shout out or a thank you to any faculty members, be it clinical, be it basic science, any staff members, anybody that really inspired you and helped you along the way.
There are so many, and I know that I'm going to miss people after I think about this further, but Dr. Ontiveros is somebody who I did some research with, and he was a great resource in connecting me with people at New Mexico State. Dr. Cyrus is someone who did a lot of stuff for me in terms of policy opportunities. Through his motivation, I was able to affect policy at the state level, at the national level in medical education, and I've continued that. And he was really inspiring. Our founding dean, Dr. Machasky, was really inspiring to me. So many people, I don't want to miss anyone, but a lot of people, faculty, and whether it was physician faculty or PhD faculty or whichever faculty they were very supportive and inspiring and helping me get to the places that I was able to get to.
That's terrific. And the last question I'll ask you, you remember the graduation. Unfortunately, it was virtual, but obviously given the circumstances of COVID, it was the best that we could do on that. And the governor, who was our keynote speaker, she made a point to say at the end of her talk that she has an eye on all the graduates, and she wants to be able, the term she used, boomerang you back to New Mexico. And so the natural question that I would ask, and I know it's a biased question, but given the opportunity, would you entertain the opportunity to come back and to practice ophthalmology in the future?
Absolutely. What happened with me is, I was applying for ophthalmology, very small field. There was actually no residency program in the state of New Mexico. So by default, I was going to have to leave the state for training. But, there's definitely interest there. And I know in northern New Mexico, there's a substantial ophthalmology presence, and in southern New Mexico, not so much. So I'll definitely be looking for those opportunities when I'm done with residency.
Super, super. Well, we'll definitely be staying in touch with you. And, you're one of the class leaders, as you mentioned earlier, involved in the Domenici Institute, involved in Santa Fe, in Washington, D.C. And, the one thing we know, the future of healthcare is very much unknown. And I guess just one last question I would say, because you were kind of a role model, what advice would you give to the students to take an active role in not just the clinical and the medicine side of healthcare, but being proactive on the policy side and the legislative side, and making a difference in that area?
Yeah, it's critically important to be involved in policy and in legislation, because if as we as medical students and as physicians, if we're not at the table, people are making decisions for us, and we see that happening time and time again. It is taxing because we have so many responsibilities: personal, professional, social, familial. But this is yet another thing that I think is worthwhile taking advantage of and being a part of. And when I say taking advantage of, I mean, if you're in New Mexico, the New Mexico Osteopathic Medical Association is very, very excited, open, and willing to incorporate students into policy work. Dr. Cyrus is very excited to get people going. We have the Student Osteopathic Medical Association, and we had multiple national leaders emerging from our school that were guiding the country, DO medical students nationally, on policy matters. So we have a reputation as well. So there are a lot of opportunities specifically at BCOM to pursue those policy agendas. And don't be intimidated. There's a starting point for everyone, but it's extremely important to advocate for your patients. And one way to do that is through health policy. And I would say if you're at BCOM, definitely go through SOMA, COSGP, and the State Association. You'll find a lot of opportunities through there.
Well, again, that's great advice. And thank you so much, Dr. Ahmed. And on behalf of everybody here at the college, we wish you a terrific 2021 and all the best.
Thank you. Hope to see you guys soon.
You bet.